Question number 4, Dr. Shane Reti.
Thank you, Mr. Speaker. To the Minister of Health, can he confirm that elective orthopaedic surgical discharges have increased by 34% from 18,240 in 2008 to 24,439 operations this year?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, yes, I can. The number of elective orthopaedic surgical discharges has increased by a third under this government, thanks in part to our $4.1 billion funding increase over the last 7 years. Orthopaedic surgeries cover things like hip and knee joint replacements, which themselves have increased by 25% from 8,400 to 10,600. This increase in surgery is a key part of National's plan to improve health services to patients and demonstrates our efforts to always do more.
Supplementary.
Supplementary question, Dr. Shane Reti.
What other reports has he received about patient access to hip and knee joint replacements?
Mr. Speaker.
Order. The Honourable Dr. Jonathan
Mr. Speaker,
Coleman.
I received a report last week which stated that access to hip and knee joint replacements in our public hospitals was getting harder, that patients were having to wait in pain before reaching the threshold number of points required to receive surgery. Upon investigation, it became clear these claims were unsubstantiated and wrong. The claims were based on the threshold score patients required for such surgery in 2013 and comparing that to the average score of patients above the threshold who received surgery in 2015. These two statistics are not the same. Disappointingly, the member that made these claims was Mrs. Annette.
Order. Order. The last part will not be necessary. Order. Order. Supplementary question, Dr. Shane Reti.
What other reports has he received about the performance of the public health system?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, I've received a range of incorrect reports this year which have followed a similar pattern, including ones that stated few GP clinics in Auckland were offering free visits to under 13s, that $1.7 billion had been cut out of the health budget, that signing the TPP would cost the health budget $1 billion and kill New Zealanders, and even about individual cases such as the Northland woman who had had her home care support hours cut but turned out to be a mental health patient. All of these claims were totally wrong, and they were all made by the same member, Annette King.
Order. Order.
Certainly wouldn't apologise to you, Mr.
Order.
Smith.
The interjection from my right is certainly not helping the order of this House.
So
Supplementary question, the Honourable
No,
Annette
I won't
King.
say sorry to you either, Jonathan.
Order. Order. I didn't hear the interjection that came from the right, but I invite the member now to rise and ask her supplementary question.
So will the Minister contact Mr Jeff Anderson and tell him that he is wrong when he says it is harder to get a knee replacement now than it was 4 years ago? Instead of mouthing, just answer the question.
The Honourable Dr. Jonathan Coleman.
Well, Mr. Speaker, as I said in my previous answer, if the member would like to supply Mr. Anderson's email address, I'm quite happy to be in touch with him.
Order.
Point of order. Mr.
Point
Speaker.
of order, the Honourable Dr. Jonathan Coleman.
Speaker, I will seek leave to table an email from Auckland DHB to my office explaining that the threshold score for patients to receive hip and knee surgery has remained unchanged since 2013.
Leave is thought to table that particular email. Is there any objection? There is none. It can be tabled. Question number 5. Order.